All right, it's 4 o'clock, so we'll go ahead and get started. Thank you everyone for joining this event. This talk is about defending high-density residential development and how we move forward the worlds of urban planning and design during and after the COVID-19 pandemic. Now we've got a few intro slides here, and I'm told that my home internet connection is a little slow, so I'm going to go ahead and turn off my own video as we proceed. We are excited that this event is part of the 2020 Seattle Design Festival. The festival runs through August 23rd, exploring the theme of About Time. Visit designinpublic.org for the full lineup of online and interactive events. I am Scott Bonjukian, an urban designer with Makers Architecture in Seattle. Makers is a multidisciplinary design firm with a staff of about 30 professionals. We work with public clients across Washington and the United States. One of our service areas is community planning, and a recent focus area has been housing. We are working on housing action plans and zoning reform for multiple cities across the state. Amid that, we're hearing concerns that high-density residential developments may be facilitating the spread of the COVID-19 disease. While that might make sense on the surface, we wanted to find out what's really going on. Is this just another excuse for skeptics to oppose housing development? Or is it a legitimate concern? We dove deep into medical research and public health guidance. The results surprised us, and we're excited to share key findings with you today. One finding will be a theme of this discussion. COVID-19 is amplifying pre-existing inequities in our society, especially in housing, mobility, and access to open space. Because this is such a wide-ranging issue, we've brought together a diverse and intelligent panel of experts. I'll make some introductions here for our speakers, and they'll tell you a little bit more about themselves later on. Crisann Brooks is Senior Director of Family Empowerment Services for the Refugee Women's Alliance. The Alliance is a nonprofit organization that promotes personal leadership and strong communities by providing refugee and immigrant women and their families with culturally and linguistically appropriate services. Crisann helps REWA advocate for social justice and equal access to services at the City of Seattle Human Services Department. Brent coordinates the city's age-friendly program, leading improvements to the 8 domains of availability, which include transportation, housing, social participation, employment, health services, and more. Previous to his current position, Brent directed long-range and current for Puget Sound and San Bay area jurisdictions and served on the Port Townsend City Council. Donald King, Principal Architect at Mymar Studio, is an architect with over 50 years of professional experience and specializes in urban design, management of community-based projects, healthcare facilities, educational facilities, affordable family housing, and special needs housing. Patience Malaba is Government Relations and Policy Director for the Housing Development Consortium of King County. HDC is made up of 180 member organizations that design, build, and fund housing from private to government agencies. Patience leads HDC's policy team by translating the needs of its members into advocacy and policy priorities and tactics. She has worked at HDC since 2018 and serves on the Seattle Planning Commission. Rick Moeller is Associate Professor of Architecture at the University of Washington, and he advances housing affordability and sustainability through teaching, practice, research, and advocacy. He is a practicing architect, chairs the American Institute of Architects Seattle Chapter, Public Policy Board, and serves on the Seattle Planning Commission as well. In 2017, he co-founded Sound Communities, a volunteer group of civic leaders focused on leveraging the Puget Sound region's investment in regional light rail and bus rapid transit. There are a number of other Maker staff here with me today that help put together this event, and they will introduce themselves later in the presentation. So, is COVID-19 the end of cities? If you listen to some of the pundits, you might believe this pandemic proves that living and working close to other people and riding public transit is no longer advisable. But the reality is that cities are not the key driver of this virus. The spread in the United States is proving to be a very special case among other countries around the world. One illustrative example of that would be to compare us to Japan. Japan has an overall population density 10 times that of the United States, and they've had only 1,000 deaths due to COVID-19. 1,000 deaths in Japan compares to over 160,000 in the United States, and unfortunately counting. The same story repeats itself for urbanized nations across the world. So clearly, it's not just the population density that is clear, or there's also other factors at play here. Here in the United States, we're also finding the virus may have started in cities because that's where our international airports are. But over time, and over the past 6 months, we're finding that the highest per capita case rates have actually not been in these urban counties. They're more focused in rural and suburban counties with particular concentrations in the rural Midwest and Sun Belts, illustrated by the map here. Further research we've looked at, looking at neighborhood level data, such as in Chicago and New York City, also shows a weak connection between density and the rate of case rates. This may all be explained by several factors. One is that non-residential places, such as our offices, our schools, and restaurants, they're all designed to be crowded, regardless of their urban, suburban, or rural location. It's just part of human nature and the way real estate is built. Another factor is that people living outside cities seem to be following social guidelines less than urban dwellers. We want to emphasize the difference between density and overcrowded housing. Even if people comply with social distancing outside the home, if home is crowded and one family member becomes sick, the virus can easily spread inside. And related to that, we're finding evidence that COVID-19 is very unlikely to spread outdoors. It's most likely spread through sustained close quarters indoors contact. And who are the people living in these households? It might not be too hard to guess for those of us who work in the design world. Folks who live in overcrowded housing tend to be lower income or roommates who are sharing housing costs, immigrant and multi-generational households, and people of color. These are the same people who are more likely to be working essential jobs outside the house. They can't work remotely, and therefore they're more at risk of infection just because of their face-to-face interactions in their work. We had a housing problem before COVID-19 hit, and we believe that if we don't keep up the pressure on building more housing in cities and suburbs, it's the most marginalized members of our community that stand to lose the most. If we respond by spreading out and stop building apartments and other dense housing, and we abandon our transit systems, that'll only exacerbate the environmental, social, and economic problems of urban sprawl that many of us are acquainted with. So we need to respond by doubling down on a just housing rebound, and that looks like building more housing and building a mixture of it. The architects and experts on our panel today might remind us that living densely doesn't mean you have to have an increase in health risks. In fact, it might be the opposite on the whole. There are a variety of housing designs suitable for urban neighborhoods and supporting a range of family types. Shown here are a few examples of moderate density options like backyard cottages, townhomes, and duplexes. We also need to use this crisis as an opportunity to look at our public outdoor space. Too many places have narrow sidewalks or not enough good-sized parks in walking distance of where people live. We have seen some interesting experimentation in this space. Cities across Washington and the nation have started closing streets to vehicle traffic, expanding where people can safely walk and bike outdoors, and giving them more breathing room. Hopefully some of those changes can be made permanent as we realize that we didn't need to dedicate so much pavement to cars. In the same realm, many places are also starting to allow businesses to spill outside onto the sidewalk and the street. This is especially important for restaurants to survive with our current economic restrictions and public health restrictions on how many people may be seated indoors. This is an example locally from Leavenworth. As planners, we feel compelled to share fact-based information on the pandemic, and we want to help communities and our colleagues avoid resisting housing because of viral fears. The key point today is that we want you to help share with others is that it appears individual actions and existing inequities are affecting the pandemic much more directly than the design and density of urban housing. That said, we're finding that cities need to be livable in order to be equitable, healthy, and successful. And COVID-19 has revealed to many of us in the urban design and planning professions that there is much work yet to be done. For more of our research and more details, we have a full blog on our website at makersarch.com. This is also a short link you can use, bit.ly/COVID-blog if you want to find out more. Next, I will go over to my colleague Ian, who will go into the COVID-19 situation specifically in King County, expanding on some of the equity concerns I discussed.
All right. Great, thank you, Scott. Yes, my name is Ian. I'm a planner with Makers Architecture and Urban Design. I'm currently working on several different housing action plans for different cities around the region. And I'm passionate about working on making good places that people can live regardless of race or economic status. One of the things I'm fascinated by is how maps and data visualization can reveal hidden patterns that we're aware of, but we don't talk about openly, and how these patterns can drive inequitable outcomes that different communities experience, including in the case of COVID-19. With that in mind, I wanted to present a little bit of local information to frame our discussion about COVID-19 and urban density. Statewide, and also in King County, we know that the distribution of COVID-19 cases has not been even. It's hit people of color the hardest, especially Hispanic folks, which have been 4 times more likely than white people to contract COVID-19, and also Black people, who have been 3 times as likely. Next slide. We also know that COVID-19 has not hit the densest neighborhoods the hardest. On the left, you can see a map that shows population density by census tract. You can see there's the densest neighborhoods are the darkest color there around downtown Seattle, with Capitol Hill, Belltown, Central District, et cetera, and with moderate density to the north and in West Seattle and down in Rainier Valley, but fairly low densities all around in the suburbs. By contrast, on the right, we can see the incidence of COVID-19 per capita across the county, with a very clear concentration in the South King County suburbs and around the I-5 corridor. Next slide, please. That's a distribution that we should be familiar with. Those are also the most diverse areas of the county there on the I-5 corridor in South County, and also the lowest income. Next slide, please. And so I wanted to dig in a little deeper to this and to better understand what's at play with where people are living and between white and non-white populations. So these maps show, maps on screen here show the distribution of white population. There's 1 dot for every 10 people. Identify as white. Here you can see there's the dense neighborhoods in Seattle, but apart from that, people are pretty well spread out. Also, a lot of white people and near the water, with access to beaches, parks, and potentially safer neighborhood streets. Next slide, please. By contrast, if you look at the neighborhoods, the places where people of color are most likely to live, they're near arterials, highways, industrial areas, the airport. And we know that COVID-19 is a respiratory illness, so air pollution is not a great thing to be living nearby. But probably more importantly is we need to reckon with where we've chosen to allow multifamily housing to exist, and by extension, where people who live in multifamily housing get to live. And perhaps questioning if we are giving the people who live in suburban multifamily housing equitable access to open space and safe places to walk and recreate, both during pandemic times and during normal times. With that local data introduction, we're going to transition to our incredible panel for a discussion moderated by my colleagues, Erica and Katie. And first, we've got a little poll that we would like to get some audience feedback on. See if I can,
Working?
Doesn't seem to be working. Perhaps no poll.
All right, well, we'll just dig in right in then if we can't get the poll running. It might pop up if Ian's able to get it running. The poll is just to kind of keep it lively, so that just puts a little more pressure on Erica and I to keep things in the panel, to keep things lively. My name is Katie Saunders. I'm a landscape architect with Makers, and I am joined today by Erica Bush, also with Makers. Do you want to introduce yourself?
Hi, everyone. I'm Erica. Thanks for joining us.
Wonderful. And we'll be co-moderating the discussion today, although I'm hoping you don't hear much from us, and it's mostly from the panelists. I'd love to just invite the panelists to briefly describe their jobs and the communities they work with. Kind of had a brief introduction from Scott during the presentation, but just a chance for you to introduce yourselves and talk a little bit more in detail about the work you do. And prior to COVID, what were some of the key challenges? And I'll start with Brent because he's the next screen that I'm seeing. So we can start with him and then we can go around.
Thank you. My name is Brent Butler, and I am implementing with many different community-based partners and many different agencies as well as departments within the city, a age-friendly communities approach to what are critically important for our health and well-being. Age-friendly communities, you might ask, what does that mean? Well, we look at it from the standpoint of making sure that we all have the opportunity in Seattle, not only to grow up, but also to grow old. So a big component of that is open space, ensuring that open space is accessible. And we look at accessibility a little bit more broadly than might be envisioned by the Americans with Disabilities Act. We look at sort of the universal design, making sure that everything is accessible and that we can age at home, and that if we are aging at home, that we have all of the critical information about the current pandemic, for example, that all of that is available. So I'm the age-friendly program manager for the city of Seattle. And we, before this project, we're working on projects to make pedestrian pathways more accessible. We were looking at connecting our Pike Place Market with our Pioneer Square. So there was a connective pathway. And when I say connective pathway, we have streets and sidewalks, but we also need rest spots for older adults that may not be able to walk a very long distance without resting. So we were looking at that. We were also looking at really quite a few projects with regards to many members of our community have had a difficulty with housing and affordability. So a critical component of our work has also been in addressing the crisis of affordability. The city of Seattle maintains an affordability web portal, and we were broadcasting information about that, getting community input and making recommendations like the recent preference policy that the Office of Housing has rolled out. So these are just some of the programs and activities that we're working on, but most importantly, those three core elements addressing the needs of our elders to age in place, recognizing King County has had some, 50,000 persons suffering from dementia, and how do we support that? And so these are all of the bailiwick of what our program has done through multiple partners. And the program, we were the 104th city in the United States to join. And it originally started by the World Health Organization. And its cheerleader in the United States is AARP. Thank you.
Thank you, Brent. That was wonderful. Crisann, do you want to join, or do you want to share some of your work in the communities that you work with?
Sure. So my name is Crisann. I am with Refugee Women's Alliance, and we work with approximately, in all of our programs, around 52 different languages spoken that represent, a multitude of different cultures and journeys that come to our agency. Most of them have been in the country anywhere from 90 days to a little over 5 years. At REWA, we really invested a lot of our time and resources in developing wraparound services for our communities so that it is a one-stop shop, so to speak. Our families, our participants that come to us lack transportation oftentimes, or they have large families, they don't have childcare. It's difficult for them to get from one appointment to the other. So if we can sustain them with, employment or housing or DV or behavioral health, those kinds of youth programs, with those kinds of programs in one central stop, that makes that so much easier for them as they move forward. So we really try to wrap our arms around our families and make REWA a part of their family as well. That being said, so we do have, our housing is one of our largest departments within our within REWA. And some of the things that we have seen over the time with our housing has been when I first started working within the housing department, we were housing people in Seattle. And slowly over the years, what we have noticed is that the housing in Seattle has really deteriorated down to where we're really housing most of the majority of our people that we house are probably Tukwila, Renton, south to Auburn, Kent, Federal Way. And it's not from a lack of desire for our families to be in Seattle. That's not it at all. It's they can't afford it. And oftentimes, we're looking at families who are making minimum wage, families who are making at the lower end of employment a pay scale. There oftentimes only one member is working. There's a lack of English proficiency. So, two people working is really difficult. Childcare is difficult at best. Transportation is difficult at best for these newer families. So there's a lot of different considerations to take into consideration when we are looking at housing somebody as well. And so it's really challenging. And so now the pandemic hit, and that threw everything up in the air. And along with the fact that, our families oftentimes have multi-generational families that live together. So not necessarily the density we're talking about the overcrowding in maybe a home that has now complicated matters. And maybe they've all participated in the family-run business that now may not be in business or is really struggling in their business. And they're really looking at, how am I going to survive? How am I going to pay for rent? Most of our families do not have a mortgage. Most of our families are paying rent. Some of the families are having to move before their leases run out, because all of a sudden the leases have jumped $500, $600, $700. So there's a lot of things that are happening within the last, probably I'd say, year. And I'd say some of that has slowed down some because of the eviction moratorium. So, since April, there hasn't been a lot of action with evictions or housing necessarily. We're able to house people, but I think the real crisis that's going to occur now is going to be when the eviction moratoriums are lifted, and some families are faced with $6,000, $7,000 that they are, at this point, we don't know that it's going to be taken off of their plate, that they may owe. And then you're going to be left with housing programs like ours, who can help with some, but we are not going to be able to help with $6,000, $7,000 worth of their rental and stuff. So there's a real sense of I think, unrest, uncertainty, kind of scaredness in the communities around affordable housing, and such within the refugee, well, just not just even the refugee, but within communities, any mainstream as well, about what's going to happen as we move forward.
Thank you much, Crisann. Sorry, I didn't mean to step on the last.
Yeah, no, that's fine.
There, that was wonderful, and I'm so glad that you brought up the eviction crisis, really, that we're at the cusp of. We're definitely going to be digging into that more, I'm sure, later in the conversation. So thanks for planting that seed. That's great. Not that it's a good seed that we want planted, but Donald, would you like to just talk a little bit about the work that you do and clients that you work with?
Sure. I'm an architect, planner, educator. I have been engaged in community-based practice for the past 4 decades. And my clients, or at least most of my clients, are those that are the ranks of the underfunded and the underrepresented and the underprotected and the overpoliced. I'm really interested in seeing what the future looks like for post-COVID, and how we prepare for the next possible pandemic or disaster that strikes those that are underprotected the hardest. and for the longest, and with more devastating impact. What we see in the ideas of, in the crisis of evictions is part of the crisis of also being underfunded, not being able to afford to purchase or own a share in your housing. And you are then subject to the financial status of your landlord, the economy, whether you've lost your job, and what you can do to improve your situation and that of your children and grandchildren. I am very interested in seeing where our discussion today goes in relationship to the intersection of the kinds of challenges that my clients have, that my community has, and finding solutions that work for both, you know, the post-COVID world, the next pandemic, the next disaster, as I said, that strikes and harms the least protected the hardest.
Kate,
Jump in because you're muted.
Thank you.
Thank you. Sorry, I was trying to keep the planes from sorry. Patience, thank you so much, first of all, Donna. That was wonderful. Patience, do you want to jump in and introduce yourself?
Yeah, sure. Thank you for inviting me here. Once again, my name is Patience Malaba. I am the Director of Government Relations and Policy at HDC. And prior to joining HDC, I worked for Seattle for Everyone, a coalition that worked on advancing the mandatory housing affordability program that resulted in rezoning about only 6% of the Seattle single family zone. So that was more of a tip of the iceberg that I look forward to expanding and seeing more work being done in a far much more systemic change way. Who is HDC? HDC is a nonprofit membership association. We represent 180 cross-sector affordable housing developers, public housing authorities, organizations that are really dedicated to the vision of ensuring that all people have a safe, healthy, and affordable home. And our role as an association is to advance policy priorities that seek to ensure the production and preservation of affordable housing and help us work towards a vision of communities of opportunity. So to the question of prior to COVID-19, what were we dealing with? We were dealing with a housing crisis, as was mentioned earlier, and that crisis has been exacerbated by the pandemic. We needed 156,000 affordable homes in and another 88,000 by 2040, just to make sure that people who are low income or moderate income are not paying more than 30% of their income towards housing. So that meant that we're going to have to produce net new homes at a total of 244,000. But we know, even in this work, that the shortfall of affordable homes has been created over the decades, and it will not be solved overnight. But we think that with this pandemic, we have such a huge opportunity to just turn the tide and make sure that we're lifting all boats. We've seen jurisdictions do work to try and increase affordable housing choices, but it has not been at the scale of the need. And the investments in terms of funding come close to matching what's needed by the communities to address the issue of the affordable housing crisis. And yet our members who are affordable housing developers and public funders have been at the front lines of this crisis in every part of our region, working towards making sure that we are increasing housing production, we're preserving the housing that we can, even with the little resources that we have. We also saw that even with that housing being in place, there was a huge challenge in terms of operating that housing and keeping the lights on. And that's another challenge that just becomes magnified in this current crisis. As someone mentioned, the issue of evictions and potential rents that are piling up, the rent delinquency, and the question that raises, particularly for some of these providers, is a very difficult place where we are advocating on the other side to really protect people from evictions. And we're also thinking of resources to try and keep the lights on in that housing as well. So I'm excited to see where the conversations go from here. And thank you for inviting me.
Thank you, Patience. It's wonderful to have you here today. Rick, we'd love to hear from you. And
thanks, Katie. Well, for about 30 years of my career, I split my time just about equally between teaching design studio at the University of Washington in the architecture department, and in private practice doing a variety of projects ranging from adaptive reuse, commercial interiors, and small scale residential, some single family, some multifamily. And about a decade ago, I began to question whether what I was doing was really reflective of my values and whether I was really adequately responding to the challenges that we were facing. So I decided to shift my focus more to full-time teaching and advocacy. And so in my teaching, I strive to use my design studios, whether they're architecture research studios or multidisciplinary studios, to advance some of the things that I'm doing outside of school as well. Also trying to build bridges between the university, the profession, and city government by serving as the co-chair of the AIA Seattle Public Policy Board, which does a lot of housing advocacy, and serving on the Seattle Planning Commission. And so in terms of housing, I'm really focused on two different scales. One is single family, and really looking at the social equity and environmental paradox of single family zoning. As a member of the commission, I was co-author of a report that we released at the end of 2018 called Neighborhoods for All, which has really led the city's conversation in terms of the future of single family zoning. And on the other end of the spectrum, I'm part of a group called Sound Communities, and I'm delighted to say that Patience has actually recently joined us in this group. And we have funding from the state, and we are engaged with a lot of state legislators looking at establishing housing benefits districts at our both light rail and bus rapid transit, although mostly bus rapid transit, to ensure that we build complete walkable communities with an abundance of both market rate and affordable housing at all of these station locations. This is the scale at which we really need to be thinking about our housing affordability crisis. It's in the hundreds of thousands of units, as Patience mentioned. We really need to begin to think about housing much the way we've thought about basic infrastructure in the past. We have no problem talking about big dollars on transportation infrastructure, $60 billion on our new light rail system. We need to be looking at housing in the same way, that it is basic public infrastructure. It needs to receive the same level of funding that we typically think of for other forms of infrastructure. So that is a part of the narrative of Sound Communities. It's a narrative that we're taking to state legislators. They're very receptive and continue to be receptive even in the face of the pandemic. Now we'll see how long that lasts as the budget crisis becomes increasingly apparent. But it's encouraging to see that level of interest and commitment from a lot of our elected officials at the state level.
Wonderful. Thanks so much, Rick. My next question, some of you sort of touched on, but we'll start there and then we can move on to the other ones. But I was just curious, for those that maybe didn't speak to this, what are some of the ways that COVID-19 has changed your work or that the communities that you worked for, and maybe describe some examples that come to mind? And I can call out on someone, or if
well,
someone...
I'm happy to start. In terms of teaching, it's been very interesting. You know, we had basically a weekend at the end of winter quarter at the University of Washington. We were the first school to go to online teaching in the country. We had a weekend to figure it out. And it's gone better than I might have suspected. But what I find interesting, teaching in an architecture program where there's a lot of one-on-one teaching, students spend a lot of time as cohorts with one another. They provide one another with a tremendous level of intellectual and emotional support. And in a sense, that rug has been pulled out from under them. And they deal with it to different levels of success. I would say the students who are struggling the most are those who are also parents. So they're trying to juggle all of these things at the same time. In terms of a lot of the other work, the advocacy work, there's a positive and a negative. The positive is that the current set of circumstances has put these long-standing racial inequities in sharp focus. And so the narrative is a lot easier. I mean, people just understand what it is, be they city staff, elected officials, or others. I think the big challenge is going to be funding. I think it's interesting because before, I think arguably we could say we had the funding, but we didn't necessarily have the political will. Now I think we have the political will. The question is, will we have the funding?
Great point.
And one of the things that I would point out that has been really significant, as we all know, as an age-friendly advocate, one of the hardest hit areas in our region has been the nursing home. The care and the quality of care and the access to nursing homes have all been significantly impacted. Through our Aging in Place initiatives, we've been supporting an alternative to nursing homes, encouraging people to live in their homes. And that has been historically what most people desire, to live at home through their natural life. But at the same time, we're finding that the provisioning of care in a person's home is also complicated by the virus. Many caregivers are often not allowed in the home to provide the care that has been needed by many of the persons that we provide care for. As I mentioned earlier, dementia is very significant. And as a consequence of that, we have to re-evaluate all of our approaches with regards to how care will be provided. Now, as you may be aware, the governor, Inslee, has only recently changed the protocols. Now you can visit a nursing home, and they are limiting the number of persons that can go to such a facility. Another area that has been significantly impacted is our work in transportation. Transportation has been identified as a critical resource. But what we're seeing is that we have been promoting the use of transportation, but now persons that have underlying conditions, there's a concern about exposure in these public conveyances. So we are now looking at alternatives, especially for persons with disabilities that have an underlying condition. And this is looking at providing services at their home so that they don't have the likelihood of coming across someone with an infection. But therein is a big problem. There are so many adults that are in need, some 14,000. Many of you are aware of the age wave. Some 10,000 people are retiring a day. The baby boomers, the first one started to retire in 2012. So we're seeing historic numbers of persons in our community that are moving into that age of retirement, the golden years. So our program now is looking at how do we provide that type of interaction that a person would normally have, but can no longer have that interaction because they are now confined to a very limited space. And so this really comes to a lot of the livability issues. The opening of the streets. When I say opening of the streets, I mean opening them for pedestrians. And so those types of design innovations we're seeing are going to become paramount, especially in neighborhoods that don't have access to parks. In neighborhoods where they have an under allotment of open space. So we're seeing a need to be innovative. And I think that some of the recent changes that we saw recently with the closure of many streets or the opening of them for pedestrians is one of the most critical first steps. And we have to be very cognizant that we're doing this with race and social justice as a lens. So I think these are some of the opportunities that we have right now before us.
And I would say with at REWA, one of the glaring things, we've had to turn on a dime, of course, and work remotely. And one of the things that has been really glaring is that so often people would walk in or we'd make appointments and we would always meet with people in person. And now we're doing everything electronically, we're doing everything through technology. And so there is that hindrance of, does somebody have access to a printer? Does somebody have access to, Adobe? Does somebody have access to, even a PC or an iPad or anything? Are they doing everything on their phone? So we've really had to figure out like how to do something, for every document, we've had to figure out how to do it on a phone, how to do it on an iPad, how to do it without printing it, so it's been really, us trying to figure out how to support others in the capacity that they can be served. Because right now to ask them to go out and change the way they might be in the world is really not necessarily something we can ask them to do, because economically they can't even afford to even think about doing that. I mean, that's the last thing they can think about. They're thinking about unemployment and how am I even going to do that without a computer to do that on? So that's been a very big difference in how we are doing our work within our housing department.
I will just make a quick addition on how, I know I touched on this earlier, but we've had to shift our focus from just the local level advocacy to recognize that some of the biggest impact, particularly in terms of funding, is going to come from federal level. Mm-hmm. We have increased our voice on leveraging that point and really trying to drive it home and bring our membership along on that front. Then in terms of innovation, looking particularly at a time where we have public health restrictions, but we also have a housing crisis that demands that we continue to create more housing. Mm-hmm. We have worked closely with our membership in terms of looking at what are some of the regulatory limitations that we can be advocating for. And most recently, we advocated for the administrative design review exemption for our members and expedited permitting as another big component. Just really, it feels like we are overly reactive in the moment because we have to be addressing these hurdles that are coming up, and yet we cannot be doing that in person. It's all virtual. So that means it's a lot of Zoom meetings and conversations of trying to pass legislation, remotely. It's far much more difficult, but I think our membership is coming along in terms of the advocacy priorities that we know will help us through a recovery point that's equitable.
That was a perfect segue or transition to the next question. We learned and are aware of that COVID-19 has disproportionately impacted Black, Indigenous, and people of color nationwide, in Washington State and in King County. So what public investments and or policy changes related to housing and density would facilitate a more equitable recovery? And you started to touch on this, Patience, but I'd love to hear both a little bit more from you and as well the rest of the panel as to kind of get at what Donald mentioned, those sort of solutions. Are there some solutions out there?
Yeah, Katie, I'd like to take that one on and talk about the ideas of housing choices. How can we find multiple solutions to our multiple problems, particularly those of choices in housing and the idea of creating equity and wealth in communities that have long been denied that. May also be a way to look at housing, as Brent has talked about, that you can age in place. Housing for older adults, housing for families. They could even be compounds now that we know that we can do accessory dwelling units on properties to where it can be multi-generational but still have their own separate housing unit. that then reduces the density and the kinds of spreads that you would get from more dense housing. When you think about it, you know, in the accessory dwelling unit program in Seattle, it has the potential of tripling the density in a single family neighborhood. That is huge. That can take the place of, you know, if you really need to increase density by only having 100 plus unit apartment buildings. But the ideas of being able to have smaller housing, of having an environment that you have more control over, that you have more ability to clean yourself and you know who's been there, is something we've really got to take a look at. And it's also the answer to many of the other problems that we have, as I said, with housing choices, building equity and home ownership, and building a lasting legacy for your children and grandchildren.
Donald, that's also a great transition into this idea of multi-generational housing that Crisann brought up earlier, and I'd like to circle back to that. Immigrant communities and people with lower incomes are more likely, as Crisann mentioned, to live in multi-generational households due both to economic issues and pressures and for cultural reasons. What are the unique challenges and benefits of multi-generational living during COVID-19? I think we all have a sense of what the challenges are, although it'd be great to hear more about that, but also are there some opportunities and benefits?
Well, this is Crisann again, sorry.
I didn't think me.
There's a lot of challenges to it. You know, we've seen a number of times where we'll call to do a check-in with the family, and COVID has, you know, ravaged the entire family. But one of the real benefits to that is the fact that, you know, school has changed drastically, and with all of school being remote right now, it really is valuable to have, you know, grandparents or, you know, and parents both supporting the kids. With more support for the kids, they have more engagement with the school. They have more opportunities with that. Our case managers who are supporting our youth program have more opportunities to check in with somebody who actually is available to work with the kids, to check in with the school, to connect them with the school. The schools don't actually, I mean, they would prefer the parent guardian, of course, but if the parent or guardian is working and can't afford to take time off or for whatever reason, but a grandparent can be there, they're more than happy to work with a grandparent as well, as long as there's somebody there who can support and work with the kids as we go into this new kind of way of being, which, you know, we don't really know. I mean, we don't really know how long this is going to go on for school either. It also has helped for childcare. Childcare has been really limited, especially in King County for our parents. So having grandparents and living with them has allowed them to actually go to work where they might have had to quit their jobs. We've actually had some people had to quit their jobs because they didn't have somebody to take care of their kids and they had no childcare. So having somebody to take care of your kids in a time when there were no childcare for, you know, a few months, if not, I mean, they're just starting to come back now, was crucial to parents actually having an income and being able to actually stay in their house at the same time. So there are a number of benefits that have been for the multi-generational, as well as the challenges.
And I would also point out that very similar to how you've indicated that there has been this opportunity for youth, I'm seeing that there is also an opportunity for older adults. I'm looking at my own example. I have a parent who has dementia, and my brother is the only one who has stayed in the city, in New York City. And what that's meant is that he is working from home. So he's there for the first time 24/7 and able to provide that care that my mother needs. So there is a benefit to working at home, which has been an outcropping pandemic. And so those older adults that need to be cared for by their loved ones it's much easier, and and often if that household member has an understanding of how to do that, it can actually save from a budget standpoint. So I see multiple benefits in that scenario, and I'm living that personally. I'm seeing that what might not have been possible. And one of the things we have to realize is that it's a very small percentage of the persons that we love that go to nursing homes. That a lot of older adults are cared for by their children. So this amplified across the state, you're seeing greater opportunities for elder care.
Wonderful. Well, thank you for painting that picture. We kind of wanted to start off with each of your perspectives on just kind of what life experience has been in COVID from the communities that you work with, and as your work as well. Even amongst the Maker staff, we realized we were all having fairly diverse experiences with this. So it's really interesting to hear personal stories and those connections. I'm going to turn it over to Erica to dig into some more specific housing questions, and then we'll circle back at the end to look into the future a little bit. And I think we're gonna just go directly to questions, and we'll just skip over the poll, because I think this discussion, I don't want to slow the discussion down. I think it's great.
Well, thank you guys so far. And I do want to take a slight shift into how design in the built environment is starting to respond to some of these things. So very much Brent and Crisann in regards to your previous comments. But now that we are living, working, and as we said, in many cases, teaching from our homes, many having to face with challenges of constrained spaces. And at the same time, work offices are going to be going through significant restructuring. How do you see actual architectural design possibly responding to this? And what systems and or amenities do you think adding to future buildings, or have you learned in speaking with people that you think that they might just be better served by having within their homes in order to provide the services that they may be doing with family members for some time to come? And I'll jump back to maybe Crisann, because she is probably most familiar with it, but I'd love to hear from everyone.
I would say, one of the things that's really becoming very glaringly obvious in inequity across is transportation and technology. And I think it's how the homes are designed as well for technology. Like homes typically that our refugees and immigrants are moving into, that they're living in, are not necessarily designed really well for technology. So, I know some staff who have internet, they don't have to pay for it. They get internet through their apartment complex. It's just there, it's accessible for them. And then a lot of our refugee participants and our staff don't have that access. They would have to go and, bring it all the way into their apartment building, and it's all separate, and their apartments aren't even really set up for that good of technology and remote work. So, and I was actually thinking about this a little just after our conversation on Thursday, Friday, whatever, that was a long week, last week, but was also, it's not the density. I mean, I think our communities really want to live in that sort of environment because they're very culturally community-based. It's the overcrowding. So when you look at the space for, whether it's a pandemic and you're trying to, kind of quarantine somebody in your home, but serve them as well, or you're trying to set up your kids to do school, or you're a parent who's trying to work from home, in the environments that they are in right now, there's no space for them to do that. And so, an access for a kid to be able to learn while maybe everybody's in the living room and the kitchen, it's all one space. And so they're trying to sit there and learn while, the parents are there and the grandparents are there and they're all the other kids are there. And that environment is going to be a very tough environment for them to do that, or the parent to work, or, so it's just that it's from the spacing to technology to, transportation is going to be really key for people to get around, because a lot of refugees, it takes them a while to earn their driver's license when they first get here. So they really rely on public transportation often.
Yeah, absolutely. And maybe Don and Rick, from the sort of design side, what are your thoughts on this?
Yeah, I've got clients that are asking this question right now, on projects, and sort of getting beyond what I talked about as far as the small housing developments and having more control over your immediate environment. How can you take a look at what happens in multifamily buildings?
Mm-hmm.
The idea is that, we are in an airborne pandemic now. This disease is spread through the air. It's a respiratory disease. It may be something else next time.
Mm-hmm.
We're taking precautions now and doing things that just make good sense for health. It would have always made good sense for health without the pandemic. So when we look at architecture and what can be done in design, you look at things like, maybe corridors need to be wider in multifamily buildings, the public quarters. We really need to consider more about the ventilation of corridors and stairwells and elevators that we haven't thought of before. The kinds of things that hospitals have been forced to do because of the spread of disease and mold and other things in that environment. What can we learn from those things that are being done already? What can we do as far as the amenities that you have in buildings? The higher income or higher market rate condominiums will often have conference rooms that those that work from home, that have their home office in their condo, can entertain their clients in a conference room. We'd like to see more of that happening, to where there is less spread of disease if you go to the large office to meet with your client. The same is true, as I heard, as what can be done in your single family home for your children that are learning from home. So if we start to think about all the things that we have learned now from this, how do we apply it for the future? How do we apply it to design? And a lot of the tools are already there. So we kind of know how to do this. It's just that there's areas that we haven't thought about until now.
Yeah, I think Crisann brought up the issue of the digital divide, and this is making it very clear that we need municipal broadband. We simply need to create greater equality in terms of people's access to digital information. I think in residential design, I agree with everything that Donald said. I think we simply need to be seeing a greater degree of flexibility within residential design at all scales, from multifamily down to single family. I think in multifamily, it's more likely to be shared spaces that can be used for working. In single family, we'll see things shift more to a kind of live-work arrangement. It's not yet clear how much of this working from home will continue post pandemic. There's a lot of variety of opinions out there, but certainly in assuming that it does continue, I think we're going to see a dramatic reduction in single-use neighborhoods. Right, we've done such a great job in single family of just basically eliminating any other possible use. And if people are not going to want to live somewhere and work there 24/7 when there's nothing else within walking distance. So I think we're going to start to see spaces for childcare on site increasingly. We're going to see co-working spaces. We're going to see cafes and other things. And I actually am quite enthusiastic about this because I think it's something that many people have been advocating for quite some time. And it's something that we used to have. I live in a house with an accessory dwelling unit, one of the first ground up projects in the city on a corner lot. And I got some flack from my neighbors for building 2 units on this lot. What they didn't realize is that decades before I bought this lot, it had a mom and pop grocery store on the corner, 2 apartments above it, a small business next to that, and another house behind that. There were 4 households and 2 businesses on this one parcel. That's the traditional character of our single family neighborhoods. And I think we're going to see that return over time.
I'm going to add in a sort of follow-up question to that, but from your guys' standpoint, what do you foresee being the greatest challenge, policy and sort of perception-wise, with encouraging that sort of reemergence of the truly sort of mixed-use node that would, in many regards, benefit so many people within a community?
I think we'll see a gradual increase in demand for that, and a gradual decrease in resistance to it.
Yeah.
and I think there are multiple things that'll come into play. Part of it is generational.
Mm-hmm.
A lot of it is related to income, and a lot of it is related to the circumstances that we find ourselves in right now.
Yeah.
Brent, I was thinking of that whole concept, what we call Euclidean zoning, which really dates back to the 1920s. What I sense is that this whole concept of Euclidean zoning says that you have to separate the uses. There isn't an impact on your quality of life. And so what I see is that would move us away from that, the classic Euclidean zoning, so that we have within a setting multiple types of uses. And I think I go back to a certain extent. There was a famous historian, Alfred Lewis. He looked at, back at the turn of the century, he looked at including light and air and all of these components in housing. And there has been many examples of including services as well. So this is moving back, and I know that the city of Seattle, we've got many different nodes. Back 20 years ago, the city of Seattle did something called neighborhood revitalization studies to look at specific nodes throughout the city to see how they can be activated. So I sense that this will be a rebirth of that concept, that thinking.
Mm-hmm.
Is it going to be I mean, it seems like that's already happened in some wealthier neighborhoods where we have multi-use, communities where we have the condominiums on the top. We've got, businesses on the bottom part, and everything's within walking distance and stuff. But it doesn't seem to be really, expanding, I guess, or reaching to the communities that we're kind of talking about, which is, the people who I think in my head to those particular communities I'm thinking about. Our communities I serve could not afford to live there.
And this I see as a critical problem. So when you look at what has occurred in a lot of major metropolitan areas, there's been a suburbanization of poverty.
Mm-hmm.
Along with the suburbanization of poverty, what we found is that there have been persons traveling greater distances to the jobs, the employment sectors in the region. And many communities have looked at that jobs housing imbalance as problematic from a climate change standpoint, and also from the standpoint of just quality of life. That professor, Lawrence Frank at University of British Columbia, he talked about how the amount of time you spend in a car could be equated to an obesity element in the population.
Mm-hmm.
And so what I worry about when I look at where we have been for the last 30 years in suburban development is that we've created this Euclidean environment, which are suburbs without the requisite infrastructure to support all facets of life.
Yeah, we've done more than create it. We've heavily subsidized it.
Yeah, exactly.
I wanted to go back to something I had mentioned earlier, another little pitch for the Sound Communities effort. I mean, again, we are building the infrastructure to make this happen and spending $60 billion doing it. It's one side of the coin, right, which is transportation. We need the other side of the coin, which is housing and mixed use. We need to make sure that we have funding up front that we can hold land, that there's an entity that can hold land in close proximity to these stations to build affordable housing before a lot of the development takes place, to really set ourselves up to allow that to happen. We need to be building a wide variety of housing in these locations, ranging from, you know, relatively dense multifamily buildings with commercial on the ground floor to townhouses at the perimeter. You know, each one of these stations can support about 200 plus acres of development. You know, we're looking at about roughly 10,000 units at each station area. We're building 60 stations. We're set up to do this. We have to have the political will and we have to come up with the funding to do it.
Thank you. So I want to bring that back around to, I guess, what numerous folks have said about scale and about sort of the history of learning over time and how things have changed. So, and we spoke about this before, but the recovery from the Great Recession 10 years ago now was really uneven, and it genuinely exacerbated the issues that COVID is now highlighting in housing and affordability. And I'd like to hear from each of you about your perspectives and what some of the lessons learned from that recession 10 years ago were, and if you feel that we responded appropriately or where the downfalls kind of lied within that. And then in kind of response to that, well, I'll get there, but I'm gonna let you guys go for that. And I'm gonna hand it to Patience first to dive into that one.
Thanks, Erica. And to your point, the Great Recession wiped out trillions of dollars of generational wealth, particularly for Black and Latinx families and communities. And a part of that wealth was shifted to private equity investors who were able to get into the market and capture that housing that was now available. And at the same time, it was rented back to those people at very high exorbitant prices. So it's just a continuation of inequity. So when we ask ourselves, what are we learning from that era? I think the biggest is going to be, how do we alleviate the immediate financial burden that folks are feeling by making sure that there's available funding, not just to halt eviction, but keep people in place and make them whole. And the other piece of this is, how do we make sure that our moratoriums are comprehensive in terms of providing payment plans for people to be able to cover this debt that will collect over time. But at the same time, let's make the mom and pop landlords whole, because really they also invested their finances with the hope of being able to get some return on investment. And that may not be happening at this point because of COVID. The other bigger piece is, can we reimagine housing as a public good, as a human right, beyond just more of as an investment tool? Because if you really look at how housing is constructed, the big players are the folks who are more in the private equity sector, who have the finances to, go deep into their pockets and just invest. So can we shift that and make sure that some of the land is being shifted to the public? And in that way, we are really building a foundation for some of our jurisdictions to be able to respond. And I think I've mentioned this before about the opportunity for a massive acquisition that can be done strategically in the state and across the region if we are all thinking more proactively around this issue, knowing that there will be real estate reduction in terms of the presence of offices or hotels that are already running into diminishing sort of returns at this point. So how do we make sure that we're going ahead of that challenge? The other bigger one that I keep going back to is really looking at land use in a far much more very connected way, and particularly the racial inequity that's connected to it. Because we see the impact that is being experienced by the Black, Indigenous people and communities of color, because it's in our system. So the more we increase housing choices for people to have access to neighborhoods of opportunity, I think that's really important, because we have to move beyond a place where your zip code or the color of your skin is determining your social outcomes or your health outcomes. And how we get there is looking comprehensively on how we respond to this crisis at this point. And I know I've talked for much longer than I intended to. But
that's totally okay. Thank you. That was great. Were there any others that wanted to comment on that one before I jump on?
I was going to add to that too, as far as the racial inequities go and the history of them. I think we're now seeing enough reports and data and stories about what has happened, particularly in the Black community, as far as how did we get here? What can we do not to do more harm? And look at policies and be aware, empower and organize communities to be able to recognize it and to be able to demand justice and for the repair of this. I think that's where we'll be going for the future, to have that recognition and that power lay within those communities that have been impacted the most by it, that they begin to take more control over their destiny and demand the ability to prevent future harm from happening.
They have funding to do it.
Yeah.
Yeah. I mean, I try to look at the conditions we're in as optimistically as I can, but unless we take sweeping, large-scale, proactive position on this, what's likely to happen will be far, far more devastating than the last recession.
Mhm.
Doing nothing.
It will look much more like, the Depression than the recession. And I think I'm not convinced that sense of urgency is yet apparent to everyone. I think there's still a sense that things are kind of being propped up and everything's okay. There's also this very bizarre situation where some in the current economy are actually doing quite well and others are not doing well at all. But this is going to require massive investment.
Yeah, that sort of difference in how this is impacting folks has definitely been sitting heavily on my mind. And I know it has for many, that there is such a drastically different viewpoint that people are going to have coming out of this just based on their day-to-day impact, where, for some, it's really the kind of minimal inconvenience, so to speak, and they'll kind of hum along, and then others, it's really pulling the full rug out from under them, in every sense of the word, which kind of goes into my next question, which has to do with the number of evictions or the concerns of level of eviction. So obviously there's a huge concern for a mass wave of evictions, and we'd like to hear from each of you about what that would mean for the communities that you work with, and just sort of your thoughts about what we all need to do to protect from that happening.
Well, one of the things we've been doing, with the REWA, we've been treating it like the folks who can't call in for housing or come to our program for housing. We've not been acting like there's an eviction moratorium. So we've been, enrolling them in our programs. We've been paying the rent. We've been, helping them with their employment, helping them with their budgeting, helping them gain their stability, knowing that, really looking at it like, you know, nobody has said once the eviction moratorium is lifted that nobody's going to have to pay their rent, or that the mortgage, you know, the landlords aren't going to have to pay their mortgage companies. I mean, it's going to take, I mean, I don't even know what that would take, actually. I mean, you know, a do-over? I don't know. You know, but we've been really, really pushing people, anybody who can, you know, and counseling, like anytime you can pay anything, pay it. You know, we've been paying it, just treating it like there isn't one, just because, I mean, it's there for people who absolutely have no other recourse but to use that, but to not use it unless that's your recourse, because it could potentially come back to really be your downfall.
You know, I've got a question for patients and wondering, has HDC looked at programs like ones that I was involved in the old Capitol Hill Housing Improvement Program of the 80s, where we were actually building tenants positions to purchase their building. It seems like not only a great opportunity, but a great need to do this now, because what we're going to be faced with are landlords. And this is not necessarily just the protection of the landlords, but we're going to be faced with landlords who, by of no other choice, have to sell their buildings to the highest bidder. Then the tenants are really thrown out. So how can that bidder be the tenants themselves? What kinds of programs are in place? What kinds of funding is in place to make cooperative buildings for the tenants to be able to invest in their buildings and not have to face this again?
And thanks for that question, Dawn. You know, what we've seen so far is cities that are proactively going ahead and passing tenants protection policies that include the notice of intent to sell ordinance, which would give the tenants the ability to come together and buy a property if it comes up to sell. But the biggest question is the funding component of where will they get the money to be able to do so? And I think there are programs that I've seen most recently being profiled by PolicyLink that look like buyouts, where the government can be able to fund those tenants to come together to purchase that property. And I think that would be a huge win and really a great pilot to be explored in some of the areas in our region. And the program that you referenced with Capitol Hill Housing, I think, is really an exemplary one that can be remodeled and used elsewhere by different entities. So the question of evictions is really one that for us as HDC, I think beyond what we're seeing as potential policies, one that's presenting an existential threat to our members. And we are really trying to move forward on making sure that there's a stimulus package that is robust in terms of rental assistance. But if that doesn't happen, local jurisdictions should proactively pass policies that are helping those people to stay at this point. I mean, we've seen other advocates even speak of rent freeze and what that looks like, but there's a question of what is that going to mean for some of the mom and pop landlords? Are we going to have funds to also help them stay in place? And that's all really a big question that we should proactively address and prevent the massive eviction that we are seeing being projected. The projections are mentioning that we're going to be 4 to 5 times at the level of the 2008, 2010. And that just cannot be where we want to be.
And one of the things I think of immediately when I hear this is an example from another high cost area, which is the Bay Area. They created an advocate on behalf of those that were facing eviction. As you know, many persons facing eviction will leave before the eviction process carries out. So there almost is a need for a short-term measure to provide support for those households that may face eviction. The longer-term solutions, such as a right of first refusal, that goes to the tenants in a building, those would have to be worked out, I would think, by the Planning Commission if it is legally permissible. There's always those legal questions about takings. And so if those can be resolved, I think then we can have a longer term solution. And then thirdly, I just kept thinking, where was the last big example of persons not able to pay? I think of New York City in the 70s. There were so many thousands of units, tens of thousands of units that went to the city as opposed to a third party. We're in a different space now because we do have in our realm very well-seated parties that can buy those properties, unlike what New York faced 30, 40 years ago.
Yeah.
And part of what we looked at with the Capitol Hill Housing Improvement Program, this is the predecessor of Capitol Hill Housing, was not just the stick, but what could be the carrot? What could be the capital gains abatement if you were able to sell at a reasonable price to the tenants, then make the profit and be taxed on it from a higher sale. Sorry, Rick.
Oh no, I was just going to say I agree with all of this, and so much of this is going to come down to funding, and what is the narrative that supports it. And I think we're not just talking about something that might happen. We're talking about something that will inevitably happen unless we take swift and substantial action. And we're not just talking about the people who are evicted who will suffer. We're talking about substantial economic consequences for the country. This will impact nearly everyone. And we have to understand that it's not as if this is not my problem because I own a house and my employment is stable. This will be everyone's problem if what will inevitably happen without action is allowed to happen.
Thanks, Rick. And I hear you coming back to funding again and again. And so I'm going to try to skew this next question in a way that kind of gets at that, as well as there's some interesting back and forth on the chat from the audience that I'd like to sort of speak to. I think in our conversation, obviously cities are predicated on thriving and commercial centers, a place where people do business in the city, provides tax base and economic benefits to the community as a whole. Services and oriented business provide essential functions to urban communities, and this is a challenging time for many of these businesses. How can we ensure thriving commercial centers post-COVID? And added to that, not only the service-oriented businesses, but how can we encourage, and again, this is a big question for 5 minutes left, so do with it what you can, but we know that there's movement going on at a corporate level too. They're recognizing that more of their workers can work at home more effectively. How are we going to ensure that we can have a thriving urban center to provide the sort of node collective point where we can all, at the heart of the city? That's sort of a squishy question. But does anyone want to sort of start with that and we can dig into it more? And I'll give you a little bit of feedback on what was going back and forth in the chat too. There was a comment about younger generations have kind of inherently more of a transient lifestyle and have now been hit with 2 really significant economic downturns, and often I don't think there's complete consensus here, but may look upon permanent housing pessimistically. So how do these pieces come together? How can we kind of move forward in this, knowing that we want to sort of create dense urban centers, but a lot of the pieces underneath us are shifting?
I don't know, but I'll take a crack at it. So much is uncertain. And I think there are a lot of predictions that this is going to fundamentally change everything. And there are some that are not so entirely convinced of that. There are some who believe that what created cities in the first place, which is a desire to be close to other people and the whole host of benefits, social, political, economic benefits that provides, is simply not going to go away. It will continue, and that demand will allow cities to continue to thrive. We're definitely going to see some things shift, but I'm not convinced that we're just going to see, dense urban cores kind of dry up and and disappear, partly because we have so much invested in them, and it would be so expensive to replicate that somewhere else. And I think part of it is because there will continue to be a demand for that. Another point that's been brought up is, well, look how easily we shifted to working remotely. Well, yeah, that's true, but it was also a bunch of people who were working together in person prior to that, which allowed, all of these connections and these social connections were well established. Are we really going to have a workforce that working remotely that has never worked together in person? Is that really feasible? Is it possible to mentor people remotely? I think all of these things are outstanding questions. There's no question that things are going to change, but it's unclear to what degree they're going to change.
And I would also add that this element of change is, I think, somewhat dependent upon the duration of the crisis. If we're able to find a vaccine in the early part of 2021 and curtail this from playing out the worst scenarios, I think that we will see a much less pervasive impact. But if this is not something we can resolve in multiple years, we might have a new type of architecture, coronavirus or core arc, I've heard called, resulting from this. So I really think that this temporal component that really is critical to we don't know.
Thank you for tackling a not fully thought out question there. I'm going to end with hopefully one that's a little easier to at least kind of get started on. Another big one though, so, and we're close to time. It's a challenging time for optimism, but there can be opportunity in times of upheaval and change. What opportunities for cities and urban life do you think are possible in the post-COVID era? We only have a few minutes until our closer at 5:30, so this can just be a kind of round robin, top of the head.
Well, this is Crisann with REWA. I think one of the things that we've talked briefly about is that it has glaringly showed us the inequalities across the board, from economic to racial to just how some of us can do our jobs. And I think that in the long run is going to make for good discussions and will make for really good ways in which we build our future. So I think that is a plus, because it's bringing to the table conversations that would never have happened otherwise.
Great.
I would just add that I think we have an opportunity to rebuild a system, particularly with the inequities that have been laid bare. And locally, we have a huge opportunity with the 2024 major comprehensive plans for single-family zoning reform. We have a lot of places to learn from. Portland with their residential info project just passed, and we're excited and celebrating. We can be looking at some of the lessons from that. Minneapolis 2024 is another place that we're looking at, and we can be rebuilding a new system, particularly really centered on equity and leading with that social justice lens. The other piece that I think can be incorporated in that is beyond just the single family zoning reform, which Minneapolis sort of focused on, is really looking at increasing mid and middle houses and providing more housing choices for people. And of course, the other bigger one is maybe this is a time to be innovative, to think about funding and rebuilding even our economic system to a place where we're centering on people over centering on profits. So I'll end with that.
Now for me, the two big things that come up are taxation and home ownership. For the past 50 years, we've been on this trajectory of increasingly inequitable forms of taxation, where people with lesser means are paying more and more, a larger and larger percentage of their income in taxes, and those with unimaginable amounts of money are paying less and less. And my hope is that the severity of this crisis will change that trajectory for the better, so that we'll see a more equitable system of taxation, and we'll also see additional funding substantially additional funding that will result to help address a lot of these issues. We've also been on a century-long trajectory in which we have intentionally denied people of color access to home ownership, and we're seeing the consequences of that. And part of it is a land use issue, and part of it is, again, I think, a funding issue to really help people of more modest means attain the stability of home ownership and the intergenerational wealth building capacity that provides. So I would really hope that this will lead to two fundamental changes in those areas.
All right, I thought you were getting close to using the R word in reparations. That financial institutions as well as the government participated and profited from the injustices,
Yes.
particularly of African Americans over the past century. There is that avenue, and that avenue can look like a number of things. It could be just property tax justice. You know, I live in a neighborhood where people purchased $1 million homes. I didn't purchase $1 million home, but I pay the same taxes, the same property taxes as they do. But also I wanted to just comment on, you know, we're looking at, and Rick, you know this well, an opportunity to now comment on the amendments to the Seattle Comprehensive Plan. It's coming due now, and what we have learned and what we have known and what we have witnessed and experienced in the past 6 months need to be a part of that plan, and how that plan then can be more, can be instructed and informed more to do more for the people of Seattle, particularly those that have been underserved.
I see a real amazing impetus for innovation from an architectural standpoint. In some of our earlier conversations, we talked about, well, UV light being used, ventilation systems being changed. So I'm really interested in hopeful that there are some benefits that come out in looking at what we need for a healthy environment. I also hope that there is a look at, and I know California does this or required us as planners to look at how many acres per person is provided. And we had targets of open space acreage for each 10,000 or 1,000 residents. I think that has to be fine-tuned and look at that, because that's a part of the problem. But then there's another component of the jobs housing imbalance that we need to look to see, well, where are these imbalances the greatest, so we can offset that. So I see that it does make us really fine tune some of those ingredients in planning, urban planning, that I may have been really difficult to resolve, but are now so important to resolve. So I'm hopeful that through innovation and analysis that we might be able to turn the envelope, because what we're seeing now is that the very people that are hourly wage earners, they are the ones that are the hardest hit. They are the hardest hit because of transportation. They're often using transportation. They're now also the hardest hit because they're the ones that are losing the jobs the most. The manufacturing has given way to the service sector, and the service sector isn't paid very well, generally speaking. So we have some challenges ahead of us, but I think that with a thoughtful approach, we may be able to resolve it. And I'm hopeful. I remember what Rich said about 60 stations, 60 area stations. That's a really an opportunity. So I see them in the future.
Thank you so much, Brent, and to everyone on the panel. This has been an excellent conversation. I had about double the number of questions that we were able to ask, and we had a wonderful conversation. So maybe there's an opportunity to do this again in the future. But I really want to thank you all for your time, and thank you for the audience members for participating. And there's a great chat as well that's been going on of providing your feedback and thoughts, and I love the conversation around that. So I'm going to switch over to Scott, who's just going to close things out for us. But thank you.
Yes, thank you again, everyone, for a very wonderful and informative discussion. both to our panel and all the maker staff who helped pull this together, along with the Seattle Design Festival. After the event, within a couple of days or so, we plan to post the video recording of this talk online so you can share it out with your colleagues and communities who might be interested. But more broadly, we urge you to keep thinking about these social and economic issues as we move forward through and past the COVID-19 pandemic, and also as you stay connected to the rest of the Seattle Design Festival activities. So again, thank you everyone, and have a good evening.
Have a good evening. Thank you.
Thank you.
Thank you. Good night.
Good night.
Good night, everyone.
Good night.